and this is my respiratory and cardiac assessment video. This is Manaz, who has volunteered to be my patient today. She is over 18 years of age. Normally I would have my patient remove her clothing and use a drape to cover, but we will not do that for this video. I'm just going to leave her in her tank top. So I'm going to start by inspecting and palpating the heart while she's in a sitting position. I'm going to feel for the apical pulse, and I'm going to do that by feeling down to the left fifth intercostal space at the midclavicular line, and there are no abnormal pulsations, heaves, or lifts. While I'm palpating the apical pulse, I'm going to use my other hand to palpate her carotid artery. And I am noting that the carotid pulse and the apical pulse are synchronous, so that is a normal finding. I'm going to feel for the thrill over the base of the heart on both the right and the left second intercostal space. So I'm going to put my hands right here, and I do not feel a thrill. So now I'm going to percuss to estimate her heart size. So normally I would use a marking pen for this, but she has a tank top on, so I will not do that. So I'm going to start by listening for a change from a resonant to a dull tone. I'm going to go across and then down. And I would feel and change. I would notice a change from a resonant to a dull note. For a normal assessment, I would repeat the entire inspection palpation with the patient in a leaning forward and then in a supine position. I will now auscultate her heart while she is sitting up. I'm going to auscultate the 5 cardiac areas using first the diaphragm and then the bell of my stethoscope. So I'm going to do the aortic valve area, which is the second right intercostal space at the left sternal border, and then the pulmonic, the second left intercostal, and then the second pulmonic, which is at the third, and then the tricuspid at the fourth, and then the mitral or apical, which was again at the fifth left intercostal space at the midclavicular line. Okay, so while I'm here, I will assess her heart rate. Normally I would count for a full minute, but for the purposes of this video, I'm going to say that her heart rate is 72 beats per minute, and it is regular. I'm able to hear S1 and S2. I don't hear any extra sounds, any splitting of S1, any snaps, clicks, friction rubs, or murmurs. If I found a murmur, I would note characteristics such as timing, pitch, duration, or intensity. I can't hear S3 or S4, which is normal because those sounds are quiet. For a normal patient assessment, I would also repeat the entire auscultation in the left lateral recumbent position. Now we're going to move on to the respiratory assessment. First, I'm going to inspect and palpate the chest while she is sitting up. I notice her chest is normal in shape and size and symmetrical. The AP diameter of the chest is less than the lateral diameter. The color of the front is the same color as the color of the back of her skin. She does have superficial veins, but her ribs are not overly prominent. I will identify the anatomic landmarks. Start with the trachea, which is midline, the suprasternal notch, the angle of Louis, and the costal angle. And then I will go back to identify C7 and T1. And then I'm going to assess her respiratory rate and rhythm, and I would not tell her I was doing this. I would just go ahead and count her respirations for a full minute and note that she is breathing about 60 breaths per minute and that her rhythm is normal. Her chest movement is symmetrical. She is not using any accessory muscles to breathe or having any retractions. I don't hear any sounds like stridor or wheezing. I'm going to stand behind her and palpate the thoracic muscles and the spine. I don't feel any crepitus, which is kind of a crunchy kind of sound. I'm going to evaluate for tactile fremitus. So, Naz, if you could repeat the numbers 99.
99.
And again?
99.
And again?
99.
Okay, so that's a normal vibration. And I'm going to evaluate her thoracic expansion by standing behind her and placing my thumb at the level of the 10th ribs. Okay, can you take a deep breath for me? Okay, and that is normal. So now I'm going to percuss the chest. I'm going to start at the back and then I'll go to the front. So if you could face forward and put your arms in front of you and put your head kind of down. I'm checking for resonance, which is an expected sound. I don't hear any hyperresonance or dullness. If you could put your arms out like that. Okay, so now I'm going to measure for diaphragmatic excursion. And I'm going to do that by measuring down. I'm going to percuss down, and then when it goes from the resonance to dullness, I will mark that spot. And then when I will do it again, and then mark it again. So what I'm going to have you do is take a deep breath and hold it. Okay. And I'm looking for the resonance to change to dullness. Okay, so I would mark that spot, which I'm not going to do because she's wearing a tank top. Okay, you can breathe normal. Okay, so take a couple of deep breaths for me, a couple normal breaths. And then you're going to take a deep breath and you're going to hold it. Okay, so I'm going to percuss down and then find where it changes from dullness to resonance. And then I will go ahead and mark that again, and you can breathe normal. And then I would measure between the two marks, and that should be 4 centimeters, which is normal. I would then repeat this on the other side. So now I'm going to auscultate the breath sounds. So what I'm going to have you do is put your head forward and put your arms, hold your arms together. And I'm going to have you take a deep breath in and out. Okay, good. Again. Again. Okay, again. 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 Okay, now I'm going to listen to your front. Deep breath. And normally I would auscultate underneath your clothing. Okay, good. So now what I'm going to have you do is I'm going to have you say your name.
Minaz.
Okay, and say it again.
Minaz.
And that is testing for vocal resonance, and her vocal resonance is normal. Her lung sounds were clear in all fields. I don't hear any abnormal sounds like crackles, bronchi, wheezes, or friction rubs, or anything of that nature. So that concludes my respiratory exam.